Come to the causes of maternal death. This is 30.8%. This is the most commonest one, and this is hemorrhage. And hypertensive disorders has 9.1% causes. Sepsis is another 11.6% of causes. 5.7% of maternal deaths are related to abortion. Around 9.4% of maternal death is obstructed labor. There is a few deaths due to ectopic pregnancies, around 0.1% cases. Embolism is responsible for death in around another 1.6 cases. HIV and AIDS is a cause of death. Anemia in pregnancy is a cause of around 12.8% causes of maternal death. And other causes are indirect and unclassified. So what are the causes of maternal collapse? It can be a shock, it can be a cardiac cause, or it can be a cerebral cause. So among the shocks, it can be hemorrhagic vasovagal shock, anaphylactic shock, septic shock, or a uterine inversion. And the cardiac causes of maternal collapse includes arrhythmias and acute heart failure, and the cerebral causes of collapse include the postictal epilepsy, eclampsia, and cerebrovascular accidents. Some drugs and metabolites like magnesium sulfate used in preeclampsia or eclampsia, illicit drugs and toxins used in pregnancy, or hypoglycemia in pregnancy can also cause maternal collapse. Hemorrhage can be concealed or revealed. Antepartum hemorrhage, postpartum hemorrhage, hematomas, hemoperitoneums of ruptured liver, spleen, or post-LSCS, and hemothorax secondary to aortic dissection can cause maternal collapse. And pulmonary collapse causes include thromboembolism, amniotic fluid embolism, and pneumothorax. Among the obstetrical causes, they can be classified as hemorrhagic causes of maternal collapse and non-hemorrhagic causes of maternal collapse. So hemorrhagic causes include postpartum hemorrhage and rupture uterus. Non-hemorrhagic causes of maternal collapse include sepsis, eclampsia, acute uterine inversion, amniotic fluid embolism, pulmonary thromboembolism, air embolism, and Mendelssohn syndromes. Among the non-obstetric causes of collapse, we can have neurological causes, cardiac causes, pulmonary causes, metabolic causes, and anaphylactic and drug overdose. Coming to the treatable causes, they are important because we can do something about it. So we classify them as 4H, 4T, and 1E. So the 4H treatable causes of collapse include the hypovolemia, hypoxia, hypo or hyperkalemia, and hypothermia. And this lead to bleeding, dense spinal shock, neurogenic shock. These causes can lead to hypovolemic shocks, and hypoxia can found in cases of myocardial infarction, cardiomyopathy, aneurysms, and aortic dissections. Among the 4T causes of maternal collapse, we have thromboembolism, toxicity, tension pneumothorax, and cardiac tamponade. And embolism can be fluid thrombi. Toxicity is usually because of the magnesium sulfate toxicity, and pneumothorax and can be, or tamponade can be secondary to trauma or road traffic accidents in pregnancy. And eclampsia is a cause specific to pregnancy, and it can lead to intracranial bleed and maternal collapse. For the management of vasovagal syndrome, we should realize that it's important to monitor the vitals of the mother. So we have to classify the vasovagal syncope, whether the patient has abnormal vital signs, or if the patient has a good volume pulse, low, but she's pink and breathing. So if the patient is pink and breathing, just put her in left lateral position and monitor her for vitals. And if the patient is having abnormal vital signs, then we have to start large IV bowl cannula and start for the fluid resuscitation. Now, vasovagal syncope is very common in pregnancy. It can occur when mother gets up soon after delivery, and always rule out that postpartum hemorrhage in such cases.